Hello students, today we are going to study about the introduction of biopharmaceutics, which includes absorption, distribution, and protein binding of the drugs. What is biopharmaceutics? Biopharmaceutics is derived from two words, bio and pharmaceutics, whereas you means bio means life and pharmaceutics means the designing of the dosage. It is the scientific study of the interrelationship between drug formulation, absorption, bioavailability, and therapeutic response. It explains how the physical and the chemical properties of the dosage form influence the drug action in the body. Formulation affects the absorption, bioavailability affects the response, and designing of the dosage form affects the efficacy. Why biopharmaceutics matters or why biopharmaceutics is important. See, first of all, we have to optimize the efficacy, which means that efficacy will ensure that how the drug reaches its target site at the right concentration. See, for example, it can be easily understandable that if you have heard about the anti-cancer drugs have a tendency to act upon the healthy cells also. So it damages the healthy cells as well as the cancerous cells. So if we can increase the efficacy, then there are chances that the cancerous cell will be affected more and healthy cells will be less affected. Second, to minimize the toxicity. It guides the formulations to keep the drug levels within the therapeutic window. Therapeutic window means where it is the range of the plasma drug concentration in which the drug will be effectively acting upon the receptors and will be curing about your disease or mitigating the conditions or symptoms. Now, how does this problem occurs? That you might have heard about paracetamol, which is an antipyretic agent, which is used to reduce the fever in the distress condition. Now, when that drug is taken in the normal routine form, it binds with the liver cells and causes hepatotoxicity or damages to the liver cells. But when the same drug is taken into the feverish condition, then it will not affect the liver cells in a great extent. Biopharmaceutics affects the dosage form. It is critical for developing the effective, safe, and reproducible drug products. So if your biopharmaceutical study is strong, your dosage form from every batch will be acting same in the same manner, safely as well as effectively. Another important point is of bioequivalence. It is the foundation for the generic drug approval and the regulatory submissions. As you know, India is the capital of the generic drug. So many of the medicines that are available outside India or abroad are being converted into a generic form by the Indian industries or in the Indian pharmaceutical giants and being sold. So to compare their efficacy, compare their safety, bioequivalence studies are done. So biopharmaceutics is an important part for the Indian pharmaceutical scenario. Next is the drug absorption through the GIT. As we know that when we take the drug through the oral route, the drug absorption will take from the oral cavity till the anal cavity. So drug absorption is the movement of the drug from the gastrointestinal tract into systemic circulation. The small intestine is the primary site due to its physiological advantage. Key influencing factors are pH, blood flow, and drug solubility. Larger the surface area of the intestine, more the drug will be absorbed. So like villi and microvilli dramatically expand the absorption capacity. Rich blood supply. As we know that our intestines are highly supplied with the blood vessels, so easily the drug can be absorbed. And as the contact time is slow, so the drug and the mucosa interaction takes place and the drug gets absorbed. So now the mechanisms of drug absorption. Four mechanisms are there. Majorly four mechanisms are there: passive diffusion, active transport, facilitated diffusion, and endocytosis. Some other mechanisms are there which we will be discussing later on. The most common mechanism is the passive diffusion, where drugs move due to the concentration gradient. Why the word passive has been used? Because here there is no use of the energy. No ATP is spent for transferring a molecule from the site of absorption to the systemic circulation. And here the lipid solubility is a key driver. As you know, the cell membranes are made up of phospholipids. There is enough part of lipids. So a lipid soluble drug has an important role, or you can say a lipid soluble drug has a better chances to get absorbed. Next is active transport, which requires carrier proteins and ATP energy. So drugs can move against the concentration gradient, and these are saturable as well as competitive. Next is facilitated diffusion, the carrier mediated transport down the concentration gradient, where you need a carrier molecule. No energy required, but dependent upon the availability of the protein molecules, which acts as the carrier to carry the drug molecule from one section to another section. Next is endocytosis. As you are very familiar with the process of endocytosis, it means where the cells engulf the foreign particles. So here the drug is engulfed by the cell membrane, forming a vesicle. It is important for the large macromolecules and protein-based drugs. The factors which affect the gastrointestinal absorption: physiological factors are there, pharmaceutical factors are there, and other factors are there. The physiological factors are gastro-emptying time, intestinal motility, and gastrointestinal pH. Pharmaceutical factors include dosage form type, particle size, dissolution rate. Other factors: food and drug interactions, patient age, and disease conditions. So gastric emptying time, in some cases, the longer gastric emptying time favors the drug absorption. Intestinal motility: slower the intestinal motility, larger the chances to get absorbed. And the pH dependent absorption of the drug is also important, because as you know that acidic drug will remain unionized in the acidic pH, but it gets ionized in the basic pH. Similarly, the basic drug will be getting unionized in basic pH, and it will be ionized in acidic mode. Now dosage, if you talk about the dosage form design, we know that suspensions and emulsions are better absorbed as compared to the tablets. Powders are also better absorbed than the tablets. Particle size: smaller the particle size, larger the surface area, more the dissolution, and larger the absorption. The dissolution rate is somewhat affected. If the dissolution rate is higher, then the absorption of the drug is larger. Other factors like food drug interactions, as there are some foods that interact with the drug and don't allow them to absorb. Patient age and disease conditions also increase the susceptibility of the drug to get absorbed. So physiological, pharmaceutical, and patient specific factors affect the routes of drug administration. There are different routes that helps to deliver to drug from different sites to the different sites of actions: oral, sublingual, rectal, intravenous, intramuscular, subcutaneous, transdermal, inhalational, nasal, and topical. These are the different routes, and these are used for the different necessities or different actions. So, for example, if you have to use for the emergency conditions, then sublingual route is preferred. If you have to get the immediate course, or if you have an immediate requirement of the drug into the system, then you can use the intravenous. There is a subcutaneous which increases the absorption time. Transdermal is used for non-invasive method, where a patch is applied onto the skin and the drug is absorbed for a longer duration. Inhalational are mostly used for the systemic circulation, as well as localized effect of the lungs, or you can say the respiratory system. Topical, mostly used for the local effect. So drug distribution and tissue permeability. The blood-brain barrier restricts most of the hydrophilic drugs. Only small lipid-soluble molecules penetrate the CNS effectively. Blood flow, lipid solubility, and protein binding are one of the important parameters which affect the drug distribution and the tissue permeability. As we know that bounded drug doesn't get absorbed into the tissues. Lipid solubility is important because lipid solubility of the drug uh, ensures that the drug crosses the plasma membrane. The blood flow, highly perfused organs get the more amount of the drug, whereas low perfused organs get less amount of the drug. There's volume of distribution and protein binding. Apparent volume of distribution is, it will be like volume of distribution is like that a drug is able to penetrate how much volume, or it is able to spread over how much volume of the drug. High volume of distribution means that there is an extensive tissue distribution. Drug accumulates outside the plasma. Low volume of distribution means drug remains largely in the plasma, limited tissue penetration. Plasma protein binding, drugs reversibly bind to plasma proteins such as albumin and alpha-1 acid proteins. Drug interactions can occur when two highly bound protein-bound drugs compete for the same binding site, displacing each other and authentic free drug levels. Pharmacological bound is pharmacologically inactive, whereas free drug is pharmacologically active. Bound drug is too large to cross the plasma membranes and reach the receptor sites, whereas free drug is available for the distribution, receptor binding, and elimination. Clinical significance and summary of the absorption ADME cycle. The clinical impact of the protein binding is that duration of action is dependent upon protein binding. Protein binded drug has a larger DR. Toxicity risks are there. If the bound drug displaces in larger amount, then it can cause toxicity. Drug interactions are there whenever a drug may affect the protein binding nature of the second drug, whether it may displace or it may bond the drug. So biopharmaceutics is directly linked to the dosage form design to get the therapeutic response. Absorption determines the bioavailability. Protein binding shapes the pharmacokinetic parameters. As you can see, this is a body, and here it is an integrated representation. So here is that age, gender, genetics, food, drug interaction, disease conditions, dosage forms all affect the ADME, and the key factors are given. You can see, and conclusion is that our understanding of the ADME helps us design better drugs, optimize therapy, minimize toxicity, achieve better answers. Thank you. You can reach me at this mail for any further queries. Thanks.